Thank you, Bill, for kicking us off with that great start. We're now going to move on to the next topic, which is outbreak investigation, the role of the ID practitioner, and that's going to be delivered to us by Dr. Pritish Tosh, who's at Mayo Clinic working with me. Dr. Tosh went to medical school at the University of Missouri, completed his training at Mayo Clinic, including infectious disease fellowship, now practices here at at Mayo Clinic, Minnesota. His area of expertise is hospital preparedness and risk management. And his fun fact about himself is that he did 8 years of improv during high school and college before starting medical school. So are we doing improv today, Pritish? No. Okay, good, because we're still trying to, just drink coffee and... Okay, so without further ado, here's Dr. Tosh.
Thank you. Wow, it is dark in here. Can people still see everything? Okay, because how many of you, this is your first morning waking up in Hawaii? Okay, yeah. How many of you guys got up at 3 a.m.? Like the same people, yeah. Thankfully, I've been here for a week, another conference. So I appreciate everyone coming. This is a lot of faces I haven't seen before, which is really good news for this conference. It means we can come back here next year. One of the things I did after my training and fellowship in infectious diseases, went to the Epidemic Intelligence Service at the CDC, which, for those of you who are not familiar with it, is a 2-year applied epidemiology fellowship. You kind of boots in the ground. You don't actually jump out of an airplane, but it's easier to describe it that way, and really go into hot zones and try to figure out what's going on and figure out how to stop it. There's a nice book talking about sort of the history of the EIS, Epidemic Intelligence Service. It's not actually like a secret agency, although people think that it is just because they haven't heard of it. It's just a bunch of nerds. It's just a bunch of nerds who like doing this kind of fun stuff. But if you haven't heard of it, it's not because it's like some branch of the CIA. It's doing some good stats in an applied setting. But those of you who want to know a little bit more about it, there's a nice book. But when most people are thinking about, especially when I talk to medical students, like how do you approach an outbreak? And just a quick show of hands. I'm not going to talk about sort of Ebola or H5N1 influenza. How many of you guys are involved with your institution's internal hospital-acquired outbreaks?